Hello, my kind viewers. Good morning. We are back today to continue from where we left off concerning our topic high blood pressure. Today we are going to talk about secondary hypertension. And I want you to know that with the secondary hypertension, I mean, about 5 to 10% of the people who suffer high blood pressure have secondary hypertension. The last time I told you that with the primary, it's about 90 to 95 of them who have high blood pressure are suffering from the primary hypertension. So today we are going to quickly talk about the secondary hypertension and what is secondary hypertension. Secondary hypertension basically is a type of hypertension that has an underlying medical condition. Okay, so it's a type of hypertension that is caused by an underlying medical condition. So when you have a patient with secondary hypertension in front of you, you will be able to trace a medical condition leading to the person suffering the high blood pressure. Okay, so quickly, today we want to talk about some of the conditions that you know make people to have secondary hypertension. And among the people suffering secondary hypertension, among the 5 to 10% who are suffering from the secondary hypertension, 30% of them are within the age range of 18 to 40. So most of them, 30% of them are within this age range. Okay, so we are going to talk about the conditions, and I have broken them down into the various age range, okay, or the various age ranges. So the first I'm going to talk about is children, then I'll talk about adolescents, I'll talk about young adults, I'll talk about the middle-aged group or middle-aged adults, then the elderly. All right. So with the children, somebody will say, hey, so do children too suffer high blood pressure? Of course they do. So with children from birth to 11 years, about 70 to 85% of them suffer hypertension as a result of these conditions. Okay, so we have renal parenchymal disease. So renal parenchymal disease is a disease of the kidneys, okay, that affect the functional part of the kidneys. So this condition will affect the functional part of the kidney. It means that the kidneys wouldn't be able to function very well, okay, leading the person to suffer high blood pressure. All right, so we get this parenchymal disease from kidney stones, diabetes, polycystic kidney disease. So polycystic kidney disease is just like you're having some fluid in sac in the kidneys. Okay, so some fluid filled sac, small fluid filled sac accumulated in the kidneys. All right, those are the polycystic. It's just a brief description I'm giving you. And polycystic kidney disease is congenital or is genetic. So it's something that you develop, okay, as a result of the genes you have from your no predecessors or ancestors. Then glomerulonephritis, pyelonephritis. So pyelonephritis is another form of urinary tract infection. So that affects the nephrons of the kidneys. Okay, so if you don't treat it, then it will lead to some of these things. Then we have coarctation of the aorta. Coarctation of the aorta is just a disease that you are born with, that the aorta, which is the big artery carrying blood away from the heart to distribute to all parts of the body. Okay, so that aorta becomes narrow, like it's something you are born with, and because of that, the heart has to force to pump blood under pressure. All right, and it will lead to high blood pressure. We have, yes, so I think that's it for the age group from the children from birth to 11 years. From birth to 11 years. So that's it. Then we move on to adolescents. Adolescents from 12 to 18 years, 10 to 15% of them also suffer from these conditions. From secondary hypertension as a result of these conditions I mentioned. Okay, so I mentioned renal parenchymal disease. I mentioned the coarctation of the aorta. Okay, so them that suffer this condition within this age range, suffer high blood pressure within this age range, also suffer it because of this condition. Then young adults, about 5% of young adults also suffer secondary hypertension from these conditions: thyroid dysfunction. Um, we have what we call fibromuscular dysplasia. We also have renal parenchymal disease for this group too. So this group is from age 19 to 39. So when we say thyroid dysfunction, the thyroid is very important because it's a hormone that regulates, okay, I mean, the thyroid produces hormone, yes, that regulates most functions in the body, or most processes in the body, or more, let me say, more processes in the body. Sorry. So, what does it do? When it releases the hormone regulates blood pressure, regulates temperature, and so on. So, if the thyroid is dysfunctioning, it's not functioning well. If the thyroid is dysfunctioning, it's not functioning well, it means that the thyroid cannot produce the hormone that is needed to regulate the blood pressure, eventually leading to high blood pressure. Then we have the fibromuscular dysplasia. It's an issue with the blood vessels. Okay, so it makes the normal blood vessels, the cells of the blood vessels, that makes the blood vessels flexible, makes it strong. It makes it be replaced, or it is replaced with other cells that makes it rich, fibrous. It makes it thick. It makes it not flexible anymore. So it's not able to open up to take blood. It's restricted. It becomes, stiff. So as a result, the heart has to pump blood because with pressure for it to go through, because it can't open very well for the blood to flow. So that's also another cause of the secondary hypertension. Then the renal parenchymal disease I mentioned, disease of the functional part of the kidneys. You know, the kidney has a way of regulating blood pressure, the RAS system. We talked about it last week, the renin-angiotensin aldosterone system. Okay, then we have um, the middle age group. To the middle age to about 8 to 12% of them suffer hypertension, from secondary hypertension, from these causes or from these conditions. So we have for them the age is from 40 to 64 years. From 40 to 64 years. Per my research, I read from an article by Johns Hopkins Medical School. From there, then I got this. Then we have the with them, with that middle age group, these conditions make them suffer high blood pressure. That's secondary high blood pressure. So we have the hyperaldosteronism. We have the thyroid dysfunction also here. We have Cushing syndrome. We have a condition we call pheochromocytoma. Okay, so hyperaldosteronism means that overproduction of aldosterone, and we know aldosterone will lead to reabsorption of sodium and water. So it means that the more aldosterone is being produced, the more there is that reabsorption. And if you are producing it too much, you reabsorb more sodium and water, leading to more blood volume, which will eventually cause high blood pressure. Then the Cushing syndrome, it's a hormonal disorder which will cause prolonged high levels of cortisol. Cortisol is a stress hormone, and when it is released, it is able to cause, certain actions to take place in the body, like like vasoconstriction, constricting the blood vessels and all that. So causing high blood pressure. Okay, then we have the Cushing syndrome can also be caused by taking steroids, like steroids for a very long time. We have a category of drugs called steroids. So an example is prednisolone. Okay, steroid. An example is prednisolone. Then we go on to talk about the pheochromocytoma. So the pheochromocytoma is a tumor in the adrenal gland, which will cause adrenal gland to produce more of adrenaline than needed. Okay, so which will lead to high blood pressure. So that is it for the pheochromocytoma. Then the thyroid dysfunction, we've already talked about it. Let's move on. We have the last part we are talking about is the older adults. So they are from 65 years and above. And about for them 70%, okay, 17% of them suffer high blood pressure due to these conditions. That's atherosclerotic renal artery stenosis. So renal artery stenosis is the artery that carry blood. The renal artery is the artery that carry blood to the kidneys. So stenosis means that the arteries have narrowed, okay, due to maybe the plaques forming in them. So the atherosclerotic renal artery stenosis means that the renal artery has become narrow because there are plaques that have been formed in them, preventing blood to flow through them smoothly, causing the heart to pump blood under pressure in those vessels. Okay, so that is it. Then the next one, so I mean, when it leads to that, we will call it renal vascular hypertension. So the blood pressure in the arteries of the kidneys will increase, eventually leading to, secondary high blood pressure. Then we have kidney failure for this group. So kidney help with the RAS system and many other functions in the body. So as a result, the high blood the blood pressure will increase when they fail. Then we have hypothyroidism. So hypothyroidism basically is the same thing with the thyroid dysfunction. It's not able to produce is similar to that, because thyroid dysfunction can also be producing the the hormone in excess. Okay, so this one, hypothyroidism, you are not able to produce the hormone, at all. Okay, or maybe in low quantity. Let me put it that way. You're not able to produce the hormone in low quantity. I mean, in high quantity. So you produce the hormone in low quantity, which cannot perform its function to the maximum level it's supposed to, leading to high blood pressure. Because that hormone, is supposed to regulate the BP, regulate temperature, and so on. So if you don't produce it enough, you can't regulate the BP. Drugs like some drugs too are able to increase the blood pressure, okay, cause secondary hypertension, like the ketoconazole, which is an antifungal. Herbal preparation, we have ginseng. Ginseng is able to raise your blood pressure. We have ephedra, which is also an herbal preparation. Then the contraceptive pills we take, the one that, they contain estrogen and progesterone, and these hormones also lead to high blood pressure. Okay, then the secondary hypertension should be considered in the presence of these. So when you see a patient and you want to know that this patient has a secondary hypertension, these are some of the things you have to know. Okay, so we have something called resistant or severe high blood pressure. This patient is on drugs, yet the BP is not going down. You've tried all means, combinations, yet the BP isn't getting controlled. Let's say it's 180, 70, or 180, let's say 180, 120 over 120, or 180, 100. Giving the drugs, yes, the BP is staying around 160, 170. Okay, so we've done it for months and still the BP isn't going down. Some people call it malignant hypertension. Okay, so we'll move on and we'll talk about the onset of the high blood pressure before the age of 30 years. So if you get a patient who has high blood pressure before the age of 30 years, that patient may have the secondary high blood pressure. Most likely that the patient will have high secondary high blood pressure. Okay, then the last one is an acute rise in BP from previously stable readings. This person has been getting normal readings. Suddenly, the BP start to rise abnormally with very high levels. And you can also consider secondary hypertension. Okay, and the fact that you are considering doesn't mean that you treat it aside. You have to do your investigations and be sure that you are dealing with secondary hypertension. Thank you very much for your time. We are ending here. Going to continue, God willing, next week to talk about the signs and symptoms, even though basically you may not see any classical signs and symptoms, but at times people will feel symptoms, okay? Especially when it comes to the secondary hypertension, because of the conditions they may be suffering from. Okay, so today we've learned and we know that secondary hypertension is a result of a medical condition causing the high blood pressure. And even we talked about the fact that drugs too can lead to that. Okay, thank you so much for your time. Father, I pray, committing your people to your hands. I ask that let them have a blessed week. Be with them like never before and deliver them from evil. Thank you in Jesus' name for an answered prayer. Amen. Beloved, have a blessed week. Bye bye.